Tim, thank you. The number of coronavirus cases continues rising in Maryland as the economic effects continue hitting our state hard. More than 21,000 people have tested positive. Just over 1,000 have died. Nearly 1,800 are in the hospital, with just under 600 in the ICU. WJZ is live. Amy Kawada has more on the coronavirus pandemic in our state. Good morning, Amy.
Good morning, Lynn. While the number of deaths and hospitalizations are up, there are no large significant spikes, which the governor sees as a good sign. But what's not so good are those unemployment numbers. And for some, they say filing for those claims has become almost a full-time job.
Judy Kilgore is one of the almost 400,000 people in Maryland who have filed for unemployment since March.
I've worked my whole life. I've worked since I was 13, and I've always, taken care of my family and pay my bills, and it's very frustrating.
She received one check, and then they stopped coming, and she waited for hours to log on to the problematic Beacon unemployment website.
Just keep trying. That's the only thing you can do until you get the answers that you need.
Governor Hogan again apologized for the website problems in an interview with the Washington Post.
It's frustrating to me that some people were waiting way too long.
New unemployment claims are still rising. 37,225 people filed last week alone. On the health front, hospitalizations are up but stable. The governor says that's the key number he's watching to see whether Maryland can reopen.
We've had a couple of days up a little bit, but it seems to be leveling out, which is a good sign.
He says the National Guard is protecting the 500,000 tests he obtained from South Korea. Some of them are beginning to go to nursing homes, which accounts for about half of Maryland's deaths.
The National Guard and the state police are both guarding these tests at an undisclosed location. These things are being distributed. They're helping us distribute the tests.
And the governor says the hardest hit nursing homes will receive the testing first and will eventually be distributed to every nursing home in the state. Reporting live this morning, I'm Amy Kawada for WJZ.
Thank you, Amy. When it comes to the national economy, almost 1 in 5 Americans are out of work. Nearly 4 million workers filed for unemployment benefits in last week alone, pushing that total number now to a staggering 30 million. Here's some other staggering numbers for you. Nationwide, there are more now than 1 million cases of virus, COVID-19, and 63,000 people have died. And while you were asleep, federal social distancing guidelines expired. Some states now are loosening restrictions, while others are keeping them in place. Today, 35 states plan to relax their lockdowns, and some will allow stores, movie theaters, and restaurants to open with a limited amount of customers.
As businesses remain closed because of COVID-19, shop owners in Annapolis wonder what restrictions will be in place when they can finally open their doors. Sean Stryker explains how they plan to reopen safely.
Since Red Wine closed their doors on March 15th, their focus has been on one thing.
All of our thoughts, all of our ideas, all of our sleepless nights are about how do we reopen? What is that going to look like for us?
Now, one thing that seems all but certain is there will be restrictions. Restaurants could see their capacities cut by nearly 50%, even more if they have a bar. That doesn't leave much room for profit.
So the idea of opening back up at 40% is actually a little scarier than not being open at all right now.
That's because the money they would make wouldn't cover the expense of being open. So to compensate, restaurant owner Lisa Bolter isn't just thinking outside the box, she's thinking outside the building.
If we are allowed to bring our tables out to the streets, shut down those streets 6 to 10 p.m. at night, depending on where you are and who you are, it'll give you maybe 10 extra seats outside. That makes up for a big difference.
How we going? And it's not just for restaurants. Fern Elliott thinks it would be beneficial for her boutique Lilac Bijou.
I would love to put some racks out there and people will be probably feeling safer.
It's a concept the newly created Small Business Recovery Task Force can get behind.
It's the kind of event that could possibly, be a draw to bring people to the city.
And if it doesn't happen, Lisa fears what might.
If you look down Main Street right now, the street is dead. And if we don't allow creative, outside of the box thinking, those streets are going to stay that way.
Now, they did start an online petition in favor of this idea. It got 500 signatures in just the first 24 hours. They are aware that there may be a couple hurdles to overcome, such as traffic patterns and how to block off the streets. That's why they're hoping to get this figured out now so that they're ready to hit the ground running when it comes time to reopen. Reporting from Annapolis, Sean Stryker for WJZ.
A local nurse describes her experiences working during the coronavirus pandemic. Kathleen Bailey works at an acute care unit at Johns Hopkins Hospital. Right now, the 24-bed unit is completely filled with COVID-19 patients. Bailey says the work is taking both a mental and physical toll on the healthcare workers, but adds that all the support they are receiving from the community has helped keep them going.
I could probably speak for everybody, never done this job for the praise or the thanks, but it is really nice to see kind of healthcare workers getting recognized.
Bailey thanked local restaurants and businesses for donating to hospitals in this time of need, and she adds that the best way for Marylanders to help healthcare workers during this pandemic is to stay home and continue practicing safer ways of living. WJZ has everything you need to know about this pandemic. Go to WJZ.com and look under top stories for a list of resources, plus the most important links and numbers are under our quick links section.